August 10th of 2024, I had a cardiac arrest in my home. And when I went down, my son started CPR right away. The EVS teams were here right away, took over CPR for my son. They shocked me a couple times at my house, got me back, got me here to the hospital, and they were able to stabilize me enough to get me transferred to St. Mary's in Montrose.
I underwent a calcium score test, which I flunked miserably. That led over the summer of a series of escalating tests, culminating in a triple bypass surgery. It's fair to say that being able to get the screening here got me on the road to getting my heart attended to properly, which very likely could have saved my life.
But I will say that when I got home, working with the new normal, it was this team, my family here in this community that really took care of me.
When you show up to GVH, you're going to be greeted with a warm smile by somebody who's likely your neighbor or in the same community group as you. That creates a unique emotional connection and bond that really separates GVH.
Whether you're at family medicine or you're here in the hospital, you are someone we know, you're someone we love, you're someone we care for.
I'm so grateful for the nurses, the doctors, all of the staff, CNAs that have the calling to take care of people.
I can't count on how many times I've gone into a patient's room who's maybe from out of town, a big city, and they'll say, I never thought that I would get the care that I'm getting here.
It's a very different perspective than seeing it from the board position. They're all people I bump into walking downtown.
I have had so many private conversations with people thanking me for being here, where they didn't have to travel. You know, our chemotherapy nurses are wonderful.
The care here is far superior. You know, it seems like you get a lot more one-on-one care.
You know, I've been in practice a long time, and in the beginning, we didn't have all these problems. Now you've got to get on the phone and argue with somebody. The insurance companies don't want to pay for things.
Hospitals are closing. Communities are losing service.
The challenges of rural healthcare are multifold. Our reimbursement is shrinking at both the federal level through Medicaid cuts and HR1. We're seeing decreased reimbursement from commercial payers. So one of the challenges of rural healthcare in Colorado is making sure we have the right staff. So workforce development, we're competing for doctors and nurses across a national stage.
The people at the Gunnison Valley Health System are under the gun to be as efficient and keep this wonderful amenity in our community. It's vital to our community to be able to have quick responding ambulance where seconds literally save lives.
The challenge though is the cost, right? I have to run an entire healthcare system from birth to end of life services. That comes with an incredible amount of expenses. Being able to balance that with the demand that we have, making sure that we match what's coming out of our community is really important, really hard.
I appreciate all they do and trying to see how they're building everything to make it better.
We have oncology here, we have orthopedics, we have room for more, and happy to do it because we want you to stay here. We don't want anybody to have to go someplace else.
You're starting to create specialty access, so dermatology, oncology and infusion, breast surgery. And we believe it's important to figure out what are those specialties that our community needs, and then figure out how to bring those specialists to the Valley.
Fundraising is paramount, and there are a lot of very generous and able people in this community, and I think we're very blessed here to have that.
So when you donate to GVH, you'll be able to see that in the equipment that we use, the nurses that we train, the new services that we provide. All of that comes directly from philanthropy.
I would long to be one of those people that has money to support the hospital, to support this beautiful home.
If we want to be a good community member and help support the people that give back to us, we need to keep the hospital system going.
The community should support Gunnison Valley Health to enable us to get even more services. I think it's important to have access to health care here in our community because we are a community.
And I guess I just would pray in my heart that those that can help to keep this alive would do. Because it's wonderful and it's worth it.